in weight bias research and how we can like minimize our own bias that we have, one of the things is looking at like counter exemplars of like people that defy the sort of stereotype that you have. And so one of those things to me is always remembering a patient that I had who came in to see me, and they, were in a larger body. I would say they probably, if I had to think of their weight, were in like maybe 250, 275 pounds. And so initially that sort of thought was, hey, you're here to talk about weight loss surgery? That was the clinic that I was in. So I made that assumption. Well, it turned out this patient was here to transfer care. They had in fact been over 500 pounds when they started on their weight health journey. And they, were very happily and very, stable in their weight post-operatively. They had been a fabulous success of an outcome from a surgical perspective, but just by looking at them alone, you didn't know that whole past story, right? So I always use that type of an example. The other one that I use, is that if losing weight or maintaining your weight loss was easy, I mean, would Oprah Winfrey struggle so much, so publicly over all of these years, right?